Steroids cannot be used with non-steroidal anti-inflammatories, cannot be used with aspirin, should not be used with Lasix or furosemide. So all those heart dogs, and here's another reason, because of potassium depletion, it'll drop their potassium right down. Should not be used with diabetics, should not be used with heart disease, should not be used in pregnancy because it'll induce labor. Should not be used in an animal who has an infection, fungal, bacterial, or viral. Every prescription medication comes with an insert that details potential risks and side effects. The problem is, most pet lovers never see that insert, or are even informed of any potential risks before use. Whether you ultimately decide to use these medications, alternatives, or a combination of the two is your choice to make. The goal of this video is not to spread fear, but to educate and empower pet parents so you can ask informed questions and make the best decisions for your own pet. Today we want to talk about steroids, and steroids come in lots and lots and lots of forms. There's prednisone, prednisolone, dexamethasone, Depomedrol, there's another injectable one, and then Vetilog, and then triamcinolone, budesonide. There's so many different steroids that are used, and they do have their place in medicine. However, they are often used incorrectly and for too long and at doses that are too high and really wreak havoc with our pets. Kitty cats are a little bit more resistant to the side effects of steroids than dogs are, but still long-term use in cats is going to cause a lot of the same issues that we see with dogs. So I'm pretty sure that almost everybody is familiar with some of the common side effects from steroids, the increased drinking and urination. Most veterinarians are good enough to tell you that, oh, by the way, he's going to drink and pee more, so that when he has an accident in your house, you understand that it comes from the drug and that your dog hasn't suddenly developed a new problem or lost his mind. I mean, that's a possibility as well. And I want to tell you that one of my practices was only 9/10 of a mile from a practice that had been in that town for many, many, many years. And Depomedrol is a long-acting steroid injection. So it's most commonly used in cats, where cats don't like to be medicated once or twice a day with a pill. So commonly, and this is really one of the reasons that Depo was made, is that it's a slow-release formulation. It's given by injection. Guess what? Cats do like to make cancers where injections are given. So they could make a fibrosarcoma from this injection just as well as any other one. But this veterinarian down the street, I think he literally used 10 bottles of Depomedrol a day, and they're, decent sized bottles. They're multi-dose bottles. But every single set of records that ever came in from his office, the animals were given Depomedrol and given it repeatedly. The problem with Depomedrol is it has its anti-inflammatory effects for about 3 weeks, 2 to 4, depending on the animal. They all react a little differently. But it suppresses the adrenal glands for months, because the body, we all make steroids in our body, and our animals all make steroids in their body. They're made by the adrenal glands. So yesterday we talked a lot about adrenal glands when we were talking about trilostane, which, by the way, some people were really unhappy about that. I gave you the facts about trilostane. If you're using trilostane and it's working for your pet, great, go for it. I just want you to know the facts about what you're given. I'm not, there was no opinion in there. Those are the facts that are out there, and that's what I'm giving you in this series, the facts about these drugs. Our adrenal glands make cortisol and make different steroid hormones in our body. And when you give a steroid, whether it's orally or by injection or topically, it suppresses the adrenal gland because there's that feedback mechanism. The bloodstream detects that there's steroid in the system, so the adrenal gland says, whoop, I don't have to do that anymore, and it just kind of quits doing its job. So if Depomedrol only suppresses symptoms of inflammation or itching, whatever you're using it for 2 to 4 weeks, but it suppresses the adrenal glands for months, when it stops helping the symptoms, what do? Oh, well, now my cat's itching again. You go running back in, you get another injection. Well, we just keep pounding those adrenals and shutting them down. So that was a really bad way to practice, by the way. And I said if anybody ever took away his bottle of Depomedrol, the guy would have to close up his doors because he wouldn't know what else to use. It was terrible. Things that we get besides the increased drinking and urination, which can cause incontinence, we can get increased appetite, definitely, which can cause weight gain and obesity, Gastrointestinal ulceration. Remember a couple days ago when we talked about the non-steroidal anti-inflammatories and how they really can cause GI ulceration, vomiting, diarrhea, and those dark tarry stools or coffee ground vomit. So my aunt and uncle, many, many years ago, had a little tiny Maltese. And one night they were watching TV and the dog came running across the living room, tried to jump up into their laps on the sofa. The only problem was the dog misjudged the jump and the dog went head first into the arm end of the sofa. And when it fell down, it couldn't walk. So they brought the dog into me and I was like, oh geez, we really messed something up here. So I put the dog on steroids. It's a little tiny 5-pound dog. And I put her on steroids because she wasn't walking. We had spinal cord trauma. They couldn't afford to go get an MRI and all that kind of stuff. So I was like, all right, well, we'll give this a try. And this was very, very early in my holistic career. So not a whole lot of tools in my toolbox. So within a week, the dog started vomiting blood, vomiting coffee grounds, pooping out tarry stools. And I went, oh no, this dog has ulcerated. And she cannot take any more steroids. We have to stop this. Dog still wasn't walking. Now, this is one of those interesting times when I'm like, okay, I'm between a rock and a hard place. And I had the dog in the back of the clinic, and I thought, all right, I don't have anything to lose here. And I did a chiropractic adjustment on the dog. And it was one of those miracle moments where you go, oh my gosh, because after I did the adjustment, the dog gave a shake and then ran across the room like she had never had an injury. I was like, well, I should have done that on day one instead of the steroids. However, I was very new to it. The biggest problem that I had at that point was I had to go tell my aunt and uncle what I had done because I didn't do it in front of them. Obviously, they were thrilled because the dog was now running and playing and acting great. But I was like, well, I did a chiropractic adjustment on your dog. And remember, this is so early in and chiropractic was the first thing that I learned. And they're like, well, why didn't you do that last week? I said, because I thought you'd think I was a nut. Anyway, so we got the dog off the steroids and the dog recovered and everything did well. But, that's why we look for alternative therapies. In addition to the gastrointestinal ulceration, vomiting, diarrhea, tarry stools, we can get pancreatitis. These dogs that are on steroids are much more prone to pancreatitis. Dogs and cats. They're prone to increased blood pressure. Steroids can cause that because they affect the kidneys' ability to retain salt. As in, they make the kidneys retain more salt. So obviously, that's going to be a problem for animals with heart disease as well. So we never, or very, very, very rarely, it's got to be like a big emergency to use a steroid in a dog who's on heart medications or who has heart disease. Let's see. We can get muscle weakness and thinning of the skin, poor hair coat, blackheads, and calcinosis cutis, which are calcium deposits on the back. We see that in dogs with Cushing's disease because, oh yeah, when you give too many steroids over a long period of time, you have all the symptoms of Cushing's disease because we have too much steroid, which is what Cushing's disease is. That's the body producing too many steroids. This is us giving too many steroids. So that's called iatrogenic Cushing's disease, as in I caused that Cushing's disease by giving too much drug and shut down the adrenal gland. So if we just stop the steroid, then we're going to have an Addisonian crisis. So with steroids, if your animal has been on them more than about 10 days, you always have to do a tapering dose. Never just stop your steroids blindly, and you will cause a huge crash. We can get behavior changes, aggression, and panting. I've seen a lot of aggressive animals when given steroids. Can cause liver failure, diabetes, and pancreatitis and Cushing's disease. This is an immune suppressant. Depending on the dose that is given, that is going to determine how immunosuppressed the animal is. So we can see skin infections, UTIs. 30% of patients on long-term steroids actually have UTIs, but they don't have symptoms of a UTI because the steroid is decreasing the inflammation, the cystitis, the inflammation of the bladder, but it's also suppressing the immune system and allowing the bacteria to grow. So your animal may not show you that there's any signs of a urinary tract infection, yet 30% of patients that are on long-term steroids have undetected urinary infections, bacterial urinary infections. So the only way to discover them is to do a culture and sensitivity. And that's how you're going to find them, because your animal isn't. So if you have an animal that's on long-term steroids, make sure you're getting that urine checked. Look at that pH, see where they are. We can see fungal infections that take over, and it will activate viral diseases that cats are harboring. So if you have a cat who's ever had herpes or calicivirus, they don't really get cured of those viruses. It goes sort of in remission. I don't really want to use the word remission, but the symptoms go away. They're still harboring the virus, and then when we suppress the immune system or they go through a stress period, that's when it pops out and you get the runny eyes and the sneezing. It will induce labor if given to a pregnant animal. It'll interfere with thyroid tests. It'll cause increased liver enzymes and increased cholesterol. One of my dogs, I'm trying to remember which, I think it was Astro, one of my Dobermans. He's the one who developed granulomatous meningoencephalitis. This was back in 1989 because I was 8.5 months pregnant at the time and I was bedridden. The dog went out in the morning and ran out and boom, right into the side of the car. And I was like, well, that was weird. Why did the dog do that? Well, we discovered the dog was blind. He literally had gone blind overnight. So I had to get an appointment with a neurologist, and the neurologist diagnosed him with granulomatous meningoencephalitis, which is basically an autoimmune disease, and we're seeing more and more of it. Remember, this is 1989. I didn't know anything holistic. I was doing everything traditional. We were doing vaccines every year and all the heartworm preventative year-round and flea and tick and all that stuff. Feeding really crappy dry kibble. And so when I went to the neurologist, he said, this is probably caused by the distemper vaccine. You could have knocked me over. I was like, really? We get problems secondary to vaccines? Duh. So that was probably the first clue to me that, man, we better start doing things differently. So my dog never got vaccinated again after that. But he was an 80-pound dog, and he was put on 80 milligrams of prednisone a day. Now, as you can imagine, 80 milligrams of prednisone in an 80-pound dog is going to cause a lot of drinking and urination. So here I am, I'm bedridden, and I've got an 80-pound dog who every hour is just flooding, literally incontinent, just flooding urine everywhere. So we had to arrange for someone to come to our house every hour to take the dog out to pee. He was on that dose of medication for a year, because I didn't know any better. So for those of you who are saying, oh my gosh, I've been given this forever, I didn't know any better. He ended up developing ringworm over his entire body. Now, I've got an infant and I've got a dog that's got ringworm from one end to the other. That's because his immune system was so shut down, he couldn't fight it off. We're all exposed to ringworm all the time. Our animals are exposed to ringworm outside all the time. They don't get it. They don't show it. It's not a problem. Where do we see it? We see it in puppies, really see it in kittens, whose immune system is weakened. So when we suppress the immune system, we are opening these animals up to bacterial infections, fungal infections, viral infections, and it just causes, it's like this cascade effect. Interestingly, when I was looking at human studies on steroids for this, found that in humans, it causes osteoporosis. I'm sure it does the same thing in dogs if you're using it long-term, particularly in older dogs. In young animals, it will stunt their growth. And in humans, it also causes enlarged prostate, particularly in young males, where they have lots of testosterone floating around. So I'm sure in our unneutered male animals, we would see the same thing. Nobody ever looks for it. What are steroids used for? They're used for allergies, autoimmune disease, and when we have autoimmune disease, that's when we're using the higher doses like my dog had, and that's really scary, and I think that we use them. I think we could use much, much, much lower doses and get the same effect that we're looking for without causing such severe side effects. They're used for inflammation. They're used to suppress symptoms. They're used for cancer treatment, lymphoma, mast cell tumor, insulinoma. In the insulinoma, it's used to keep the blood sugar up because it will raise the blood sugar, which is why they can be prone to diabetes. Steroids don't cure anything. They stop the symptoms. Now, in autoimmune disease, yes, they'll help cut off what is going on because we've got an immune system in disarray. It's just gone nuts. It doesn't know what to do anymore. That's kind of where I look at steroids and go, I have an animal with autoimmune hemolytic anemia. I have an animal with immune-mediated thrombocytopenia. So he's got no platelets. He can't clot. He's going to bleed out. He has no red blood cells because he's killing them all off. Okay, maybe we need a short-term steroid. We got to get this fire put out. But that doesn't mean, like my dog, that the dog stays on that. My dog regained his vision within 24 hours. Did he need to stay on 80 milligrams of prednisone a day for a year? Absolutely not. If I had known any better, And bless his heart, he never developed GI ulceration. If I were to go back and do that again, I might have given him a one-time high dose, and then that dose would have been cut down so fast because he regained vision. The inflammation went down. Steroids cannot be used with non-steroidal anti-inflammatories, cannot be used with aspirin, should not be used with Lasix or furosemide, so all those heart dogs, and here's another reason, because of potassium depletion, it'll drop their potassium right down. Should not be used with diabetics, should not be used with heart disease, should not be used in pregnancy because it'll induce labor. Should not be used in an animal who has an infection, fungal, bacterial, or viral. Well, how many times are we using steroids when they've got pyoderma, skin infection, and pustules all over the place, and you go home with your steroids and your antibiotics? Well, we're just saying, come on, super infection, come on down and jump on board. It's a big problem. Should not be given to dogs with Cushing's disease. They already have too much steroid in their body. Should not be given in any animals that have any kind of GI ulceration. So animals with kidney disease who have a high BUN and may have some ulceration, absolutely, you don't want to give a steroid on top of that. And you don't want to use it in growing young dogs because it will stunt their growth. I didn't find anything about cats with that, but I would think if you gave it to young cats, you could have the same issues. So Cushing's dogs, we know they are prone to throw clots, and that's high steroids. So they could develop blood clots and high blood pressure as well. When we talk about muscle atrophy, I had a dog who had aplastic anemia, so couldn't make any red blood cells, bone marrow just stopped. Dog was at the university on really high doses of steroids, cyclosporin, and had had 3 blood transfusions and was not responding at all. And the university said, dead dog, nothing more we can do. And the owner said, I'm not buying that. Came to me, we did acupuncture, we did herbs, and we did diet therapy. Dog rebounded beautifully. Took her off all the drugs, but when she came to me, she had no muscles left on her head. She had complete atrophy, so she had this skull with skin on it. And by getting her off the drugs, you know, obviously we had to wean her down a little bit because she had been on so much, but she responded beautifully to therapy, and she did develop all of her head muscles back again once the steroids, you know, were out of her body and she got rid of all the Cushingoid symptoms. You're treating a dog with high dose of steroids, and now you've got secondary bacterial infection, secondary fungal infection, you've got all these other things going on. So now your veterinarian says, okay, well now we're going to put him on ketoconazole for his fungal infection, and we're going to put him on antibiotic for his bacterial infection. And it's kind of like what we talked about with everything else. You're using so many drugs to treat the side effects of the other drugs. It's better to solve the problem. So when we're using these for allergies, they're suppressing the symptoms. They're not curing the allergies. You still have to work on the allergy problem. When we're using it for cancers like lymphoma, you know, that's a tough box to be in, because we know that steroids work pretty darn well for certain cancers. Unfortunately, they also have really severe side effects, and at some point the cancer will become resistant to that steroid, and upping the dose doesn't help. So when they reach that brick wall of, I'm not responding to that steroid anymore, they're not going to respond to the steroid no matter what. Inhaled steroids have less side effects, but I did have a client whose cat was on an inhaler, and she was using it 3 times a day for his asthma. And again, it was not curing the problem. We weren't addressing the you know, new client to me, not addressing the underlying problem that was causing the asthma, just literally kept throwing more steroids at it. The cat ended up bald. Completely, I'd never seen this before, completely bald from all the steroids. Like, it had all of the symptoms of a dog with Cushing's disease. It had bald skin, muscle wasting, thin skin, calcium deposits on it. I think it was terrible. We ended up getting the cat on, you know, dietary therapy, herbal therapy, acupuncture, cleaned up things in the environment that were affecting the cat, like chemicals that were being used, that sort of thing. So what is considered a low dose? Well, the higher doses that are used for autoimmune disease are like 1 milligram per pound per day. So that was my Doberman, was on 80 milligrams for an 80-pound dog. That's a lot. I want to get them down like a physiologic dose of prednisone. Let's say you have a dog with Addison's disease and you need to replace the amount of steroid in the body. I had a patient that was a 50-ish pound boxer that had Addison's disease, and her physiologic dose was about 2.5 milligrams a day. You know, that's a very, very, very tiny, that's like 0.05 milligrams per pound of body weight is what the dog actually needs. You want to go as low as possible. Now, when you're dealing with the cancers, they're going to use they're not going to use those autoimmune doses, but they're going to use higher doses. And in kitty cats, they tend to use higher doses because they are more resistant to the side effects. And for lymphoma kitties, they do really well with pred. So I had a cat with lymphoma. It started in his throat. Eventually it went to his kidneys, but he was on prednisone for a year. He was not able to eat because it was in his throat. We had a feeding tube put in, started him on prednisone, and started him on Tagamet, I think. Within a couple of days, he was eating. Within 30 days, his stomach tube fell out on its own. I think I only used it for, a few days. And he lived for another year. And then his lymphoma, I went away on a trip and we had a pet sitter, very nice pet sitter, but it was not mama. And in that 2-week period that I was away, that was stressful for the cat. And when I came home, his lymphoma had spread to his kidneys. His kidneys were basketballs. I mean, they were just huge. And he stopped eating. So stress is, for these animals with cancer and immune problems, stress is a big deal for them. Now, if you have horrible inflammation, when we posted this, somebody said that their dog's ears blew up. They were bright red, really thick because of all the swelling. So they had to give a steroid. That's what a steroid is for, but it's for short-term use. Steroids were never meant to be used for a lifetime. They're not meant to be used indiscriminately at high doses. They're meant to be used kind of, all right, we got to put the brakes on here. Let's stop this reaction that's happening. All right, good. We're 48 hours in. The reaction's good. Now, let's fix the underlying problem. And this is where traditional medicine and holistic medicine go bleh, because traditional medicine, you're going to end up with higher doses of steroids for a much longer period of time. With holistic medicine, if you have a homeopathic veterinarian, they're going to give you homeopathic remedies. If you have a TCBM veterinarian, they may want to go with acupuncture and herbs. If you have an integrated veterinarian, maybe they're going to say, okay, I'm going to use steroids for a day or two just to get things under control, but we got to fix this underlying problem, whether that's the diet, whether that's the over-vaccination, whether that's the confused immune system. There's a lot of different things that need to be done. And so the big problem is not wanting to fix the underlying problem. What is an alternative to prednisone to treat and manage IBD for dogs? Fix the leaky gut, fix the immune system, find the right diet for the dog, use natural alternatives. I mean, there's so many natural anti-inflammatories, the PEA, plant-based sterols, so many other things, but really it's about fixing that leaky gut and fixing the diet. For lymphoma, prednisone is kind of a mainstay for that. Most, even holistic veterinarians, I used prednisone for lymphoma, particularly for my patients who didn't want to have chemotherapy, just to get the swelling down in those lymph nodes, make them so they could eat and breathe better. And then, again, you're working on getting the body to heal. So, okay. I got a million things to go do.